Okay, all ready to get started? Good. Good afternoon. I woke up this morning with laryngitis. That's what I was going for. So y'all are going to have to sit through this. This is not my normal voice. And I don't usually work with a mic like this. I feel like a stand-up comic. And I'm not that funny. Okay. Before I introduce myself, I want to find out something. How many of you are licensed mental health professionals who work with kids? Okay, there's a few. How many of you work with kids but you're not a licensed professional? Great. How many of you are parents? How many of you are parents with kids living at home? Okay, sorry. How many of you give presentations like this? Okay, so there's some presenters. Okay, final question. This is kind of a poll I'm doing. How many of you are enjoying the presidential election season? Wow, you're the first. Okay, good for you. Glad to hear it. Okay, so about me, my name is Geoff. I'm a psychologist. I work at Clarity Child Guidance Center. Next month I will have been there 21 years. I want to tell you just a little bit about Clarity, not so much in the commercial, but just so you know what resources we have. We've been around since 1886, by the way, started as an orphanage. We're a private, not-for-profit children's psychiatric hospital. We have 66-bed inpatient acute units, and we have 2 day hospital programs. We have a comprehensive recreation therapy program that supports those. We have outpatient services that include psychiatry, individual family group therapy, psychological, neuropsychological assessment. And we're a training hospital. We train psychiatry residents, psychology interns, nurses, etc. About 300 FTEs, 300 staff. Okay, so what I'm going to try to do here, I want to talk with you a little bit about the factors in the AD situation is a little weird, but it's working. I want to talk with you a little bit about the factors that we assess as professionals, so you have a sense of that. Then we'll talk a little bit about common psychiatric diagnosis for kids, because you hear it all the time. Just try to explain a little bit what are the main things and what makes them similar and different. And then, my real goal is to leave you with some tools today. I'm going to show you some websites. I'm going to show you one that will tell you what to look for if you have a kid in your world that you're concerned about. And then I'm going to show you a website that will tell you what to do. And then a few other things. Okay, so my thinking is not for you to go away from here and remember what I said, but to have something you can take with you. And I want you to put one of these resources in your phone while we're here, if you want to. Okay, does anybody know what this is? Target, right. I chose the right thing then. Okay. Actually, my wife did this for me. I couldn't make it work. Thank you, Liz. Okay, it also represents an ecology, okay? So kids live in an ecology. Around them, there's a family of some kind, usually. There's a school, and there's a community, okay? And I want to introduce another concept to you of the continuum. To think in terms of continuums instead of boxes, okay? We think a lot in boxes. He's a this, she's a that. When we assess kids, we think about what is their relative strength or weakness on a particular dimension. Where do they fall? Okay? In So, for example, genetics. Kids are born with a genetic predisposition. They're born with a certain capacity for physical health and for mental health. Somewhere on the continuum, strong to weak. You're sneaking up on me. Temperamental fit. Temperament, okay? This is another example. I don't know if you can see these back there, but these are the basic temperaments that we're born with. So take the top one, activity level. Some kids are born wired with a high activity level. Some kids have a low activity level, but most kids are somewhere in the middle. Does that make sense? Why is that important? Well, imagine that you have a couple of parents who are very low activity level, and they get a kid all of a sudden who's super high activity level. Okay, this is what we call temperamental fit, right? And so what really matters on a lot of things with kids is how well what they have fits the environment they're in. So if you have a kid who has parents who want to go hiking every weekend, and the kid is just a low activity, just wired that way, that can cause problems. There are things like IQ, intelligence. Some kids are naturally very smart. Some kids are not so smart, and most kids are in the middle. So most of these things don't matter when kids are in the middle. It's when they're on one end or the other. So someone who has very low intellectual functioning are not going to perform in school the same as someone who is very gifted. But someone who's very gifted may have other kinds of stressors, like high demands or high expectations. And then there's social and emotional development. We see kids, you see kids, who look like they're 15, but they're functioning socially and emotionally, say at maybe a 10-year-old level. So it's where are they on the continuum on any factor. Same thing for the family, okay? You have all different kinds of family situations. You have families that are disconnected, that are chaotic, that are blended, that are intact, that are very closed off, or that are very open. So there's a lot of differences. Families can be low economic status, they can be high, they can be in the middle. They can have a lot of resources, low resources, mid-range resources. So this is something that we look at because this is a source of potential support or stress. So you have a family that has very low supervision, very low support, versus a family that's very engaged and has a lot of support and everything in between. But we want to know that because it has a lot to do with how kids are functioning. Their schools are very different in terms of, for example, the number of counselors, the number and quality of the faculty, of the extracurricular activities, of the peer culture. So the school can be a great resource, but it can also cause stress. And anywhere in between. I told the group before, yesterday one of our therapists was telling me that her 5th grade son had been told by his 5th grade teachers that he couldn't have spiky hair anymore. And he's had spiky hairs basically his whole life. So the kid was really, really agitated. A good kid, very agitated. And the mom was able to go to the school because he has a supportive, engaged mom, and talk to the school, talk to the principal who said, no, that doesn't make any sense. I'll talk to the teacher. But she's engaged, so they reduced that stress. Does that make sense? Then community. Is kids' neighborhood safe? Is it not safe? Do they have parks, churches, boys' clubs, girls' clubs, things to do? one other concept I want to suggest to you, and it's what I call FTEs, adult FTEs. Think about how, for a kid, one of the things we really look for when we assess a kid is how many kids or how many adults are involved in the kid's life. How many full-time equivalents? That's an HR term, right? So, single parent family, 3 kids. Each kid has a 0.3 FTE in the family environment. That's not much support. How many people at school have their eyes on the kid and are engaged and supportive to the kid? How many people in the community? So many kids that we see, they don't have any support in the community. There's no adult, and we always ask them. A standard assessment question I ask is, we ask, what do you want to be when you grow up? That's a standard question. But then we ask, who do you know that does that? So many kids say, I'm going to be in the military. Who do you know that does that? Nobody. They don't really have a real figure. Okay. So here's the shift for a minute to diagnoses. I'm just going to tell you about the main ones, okay, that we see the most. There's mood disorders. Mood is about how happy, energetic, engaged the kid is. Anxiety, how nervous or worried or fearful. Thinking, we assess kids' reasoning, their judgment, and just their basic intellectual functioning. And then there's behavioral. It's sort of how well controlled, how much self-control does a kid have? How impulsive are they? I'm going to introduce you to philosopher, psychologist named Schenker, he really focuses on not self-control, but self-regulation. His idea of self-control is about trying to control what's already coming out. But he points out that kids today have a hard time being calm so that they don't have to control something. We'll talk more about that in a minute. So some sample diagnoses for mood, depression, bipolar disorder, and this thing called disruptive mood dysregulation disorder. That last one, how many of you have heard of that before? Okay, it's a new diagnosis, and it captures what, we used to have so many kids diagnosed with bipolar who were not bipolar. They're just kids who can't control, can't regulate themselves, but have aggression. These kids are really irritable real easily, and they're aggressive, and they have temper tantrums. They're tough to work with, but they are out there. Anxiety, generalized anxiety disorder, specific phobia. Don't know what is the most common specific phobia? It's public speaking. And it can lead to panic attacks. And then social anxiety disorder. Thinking, how well can a person guide or use their thinking, their judgment? We see a lot of kids, little kids, who are very inflexible in the way they think. When it comes to problem solving, they got one way to do it, and they don't want to see another way. And also a lot of kids we see are socially impaired. They don't know how to join a group, how to play cooperatively. They don't know what to do with leisure time. I mean, it's very common. And then behavioral, oppositional defiant disorder, and conduct disorders. Okay, but the good news is you guys don't need to really know diagnoses. I don't know if I already said this, but diagnoses really don't tell us much about a kid. It tells us what kind of category of problem they have. But 2 kids with that DMDD will be totally different because of that first slide with the bullseye, because every kid's bullseye is different, no matter what their disorder. We got to look at their family, school, community, right, to understand them. So this website, campaign to change direction. Let me show you this. looks like this. I believe it's on your handout. Chris Stapleton, this guy, has written like 6 #1 songs for other people, and now he's getting out in front of himself. So this is about know the 5 signs. So all the stuff that we've talked about already falls into one of these 5 categories. And so if you're around a kid or have a kid in your world you're concerned about, this will tell you what to look for. So you just scroll down, and it shows you these categories. Personality change, agitation, withdrawal, poor self-care, and hopelessness. So the idea is that if a kid changes on one of these, there could be a problem. And when you click on these, it gives you a definition. It tells you how to know what you're seeing. I mean, what to look for. Let's say on poor self-care. It says they stop taking care of themselves and may engage in risky behavior. You may notice a change in the person's level of personal care or an act of poor judgment on his or her part, etc. So, if you see a kid with some changes, this kind of helps organize what you're seeing, okay? And if you're seeing 2 or 3 of these things, that's not good. So what do you do then if you do? Well, down here, it says if you recognize that someone in your life is suffering, now what? You connect, you reach out, you inspire, hope, and you offer help. But not all of us are able to do that for whatever reason. So there's a find help button here. So you go here, and you get these resources. The 2 upper left are the ones that I want you to focus on. There's a crisis text line, so you can text to this number and say, hey, I have this situation, and I'm not sure what I should be doing with it. I'm seeing this kid who's got these 2 changes going on, and I'm worried about them. And that will connect you with a professional counselor who's more of an expert on figuring out how serious this is and whether maybe we should be doing something. As I said to the group, one of the most common things we hear when people bring their kids to us is, I wish we had done this sooner. Okay? Well, it's a big step, you know, like to come to our psychiatric hospital, bring your kid there, it's a big step. This is an intermediate step. Okay? Now, the one that I want you to put in your phone, or I recommend you do, is a suicide prevention lifeline. They work with more than just suicide. Okay, here it is. So the number's here.
Can you read it out?
Yes, it's 800. It's also on the handout. 273 8255 24/7. Now, here's what I want you to see down here. Who should call? It says, if you feel you're in a crisis, whether or not you are thinking about killing yourself, please call the lifeline. People have called us for help with substance abuse, economic worries, relationship and family problems, sexual orientation, illness, getting over abuse, depression, mental and physical illness, and even loneliness. So you call that number and you're going to get a professional counselor. Okay? So one of the great things about these tools is they're that bridge when you're not sure what to do. Does that make sense? Okay, special topic. I got behind and let's speed up. Suicide risk factors. Just want to touch on this. The main factors are these: recent or serious loss, a psychiatric disorder, particularly mood disorder. If anybody wants this slideshow, I'll be glad to send it to you. Because I just thought of it. Prior suicide attempts, alcohol and other substance use disorders, struggling with sexual orientation, and this is more about the environment. If a kid is wondering, thinking about coming out, and the environment is hostile to that, that's a risk factor. Family history of suicide is a big risk factor. Lack of social support, bullying, access to legal means like pills, firearms, the stigma associated with asking for help, just barriers to access. There's not enough services. And certain kinds of cultural or religious beliefs that may support the idea of suicide. So what do you do? Any threat of suicide demands immediate attention. Any threat. Sometimes parents or people will think, this kid is being dramatic. They would never do that. Well, the thing about that is kids are a good judge of lethality. And so they may do something to get your attention and misjudge what they're doing. Take too many pills. Any threat of suicide is a cry for help. And at the very least, call the lifeline if you know a kid who's made an outcry. And how you react can be crucial. It's important to be supportive. Sometimes for parents, they're not supportive because it just rattles them so much. And someone close to your child's committed suicide is really important to talk to them about. Because kids, adolescents, sometimes, they don't have much experience, and they can have thoughts that are not realistic, like, I should have done something, why didn't I know, or something like that. You need to check it out, make sure that's not going on. Resources. 1 in 5 Minds is an advocacy group. So I'm going to close by giving you some resources. So there are a lot of people who go to this website and tell their stories and talk about what happened in their world, their life, and what they did and what was helpful to them. Here's a quick little TV commercial.
Did you know that 1 in 5 kids has a serious mental illness?
If left untreated, that 1 in 5 will likely drop out of school.
Or do drugs. If left untreated, that 1 in 5 may end up in prison.
If left untreated, that 1 in 5 may end up dead.
We need to get 1 in 5 kids the help they need.
Help make a difference today. Visit 1in5minds.org. There's a 1 in 5 chance you know someone that needs help.
Okay, this is, let's see, right here. The American Academy of Child and Adolescent Psychiatry has this page at their website that's called Facts for Families, and they have a really wide variety of articles about kids, not just strictly mental health. They have articles, for example, about death of a pet and how to help a kid with that. Really a rich library of information. This book is aimed more at children, how to talk so kids will listen so kids will talk. It's a book that therapists at my place use a lot with families. For adolescents, if you have adolescents, get this book. It's by Lawrence Steinberg. He's like the expert on, he's done more research lessons than anybody. He knows a lot of brain development, but he knows a lot of other stuff too. This book is basically like a user's manual for adolescents, and he addresses just about every topic there is. And it's laid out kind of like I met him and spent a little time with him, and he told me that he laid it out like a Dr. Spock book to make it easy for parents to access what it is they want to know about and not have to go through a bunch of other stuff.
Does it open up to eating disorders?
Yes, there is information in it. Yep. Yeah, he has quite a section on eating disorders. This book, Stuart Shanker, I don't know if I got this one on the list. I just learned about this one yesterday. Self-reg. So he's the guy who talks about his mission in life is to reduce stress for kids, their parents, and for schools. And I want you to know about this. He's doing, oh, my son is he's doing a 30-day self-reg challenge. So you can sign up, you can do a stress survey for yourself, your kid can sign up, schools, teachers can sign up. And starting, you choose the day to start in September, you get 30 days of support on reducing stress in your kids' world and your world and school. So take a look at that and see what you think. It's a very well done website. And then there's those two other that we already looked at, Campaign to Change Direction, and the National Suicide Prevention Lifeline. Those are on your handout. And then that 30-day self-reg challenge. We have about 2 minutes. Questions, yes, ma'am?
How do we get this information out of schools? Because my daughter, I mean, was a high achiever, you know, easy, great classes, couldn't cope. You know, didn't want to admit that she couldn't cope because she had perfectionist tendencies. She was having well done in school, got sent to a guidance counselor. This woman was trained to make class schedules, not to offer any sort of real counseling. Guidance counselor told her, my life is a lot worse than your life, suck it up, deal with it. 3 days later, she's having a similar situation. But she knows that the school's not going to provide her with any help. She doesn't feel like this is when she was her junior year of high school. So she's a young junior, but she was like 15 when this went down. So she can't cope. She doesn't feel like she can come to parents because she thinks parents aren't going to understand, because teenagers often think that. Friends are telling her she needs to get help, but she's tried to get help. She tried to talk to this counselor. So her and her best friend run away. Thank the Lord, they were gone for 48 hours. They ran out of money. The friend realized it was worth going home. They got to a church. I've always told my kid, if you ever need help in this country, there's no reason you can't get help, because there's churches everywhere. Someone will help you. The church got her a police officer, who got a daughter who got her to Laurel Ridge. She got help. But the school absolutely had nothing in place. They didn't know she had left campus. They had nothing. And we've had, suicides out of that school. Recently there was a student who was killed by someone they had dated. It's a huge school, and we have those big schools all over San Antonio. It's not Judson, it's not Northeast, it's all the high schools. But it doesn't seem like that they're having, they have funding for workshops and classes, and I know there's grants to provide everything. It doesn't seem like the kids have the information who to call when their friends are having trouble, because we know that they go to their friends first. And it doesn't seem like there's, in the guidance counseling department, there are actually people that have, it's not a scheduling problem, that have the knowledge to help.
Does your high school not have community in school?
Not that
At Steele High School, when I worked there, they have a program called Community in Schools, because I felt like you did. I was a teacher at the school, and a lot of the students would come to me and, open up to me. And I had nowhere to send them only because of the scheduling thing. So,
Community schools is
Community
a
schools.
limited number of
Yes.
So, yeah, that's a great point.
I mean, I'm finding out there's all these resources that I didn't know were available when my daughter was going through this, even though we did go to different professionals. You know, I was unaware of all of these services that existed. But when we're talking about public services and we're talking about public education, I think there needs to be a better partnership
Yeah.
between those two, because, especially because a lot of the things that are warning signs and triggers, how do you know if it's just teenage moodiness versus, I mean, it's a lot of stuff that, in one kid it could just be teenage moodiness, and in another kid it could be they're having severe depression.
Yeah, I agree, and it is a difficult issue. We work with schools all the time, and it's a big challenge because it's a multi-layered thing.
Can I add something to that? Just a tip. When you are, I work with the schools, but outside the schools, make sure you document everything. Phone calls, text, emails, who you talk to, what day you talk to them, what time you talk to them. Because when you finally get to somebody who can do something, they're gonna wanna know, well, what have you done?
Yeah, that's good.
Yeah.
All right, guys, we are out of time. I hope you got some resources.